Acute promyelocytic leukemia is one of the diseases where we have seen most advances in the last years, and there is a targeted treatment which is the combination of arsenic trioxide plus all-trans retinoic acid. And this treatment is approved for standard risk APL and induces prolonged survival in over 90% of the patients. And as compared to the chemotherapy, standard chemotherapy, AIDA or AIDA-like regimens, where we see survival rates of about 80% at almost 5 years. And we still see relapses following AIDA chemotherapy, about 13%, again at 4.5 years of follow-up, versus 3 to 4% in patients treated with a chemo-free combination. This is actually the way we should treat patients with APL. In standard risk APL, the regimen is approved, but also high-risk APL. Both data from our Harmony combined database, including patients treated in the UK AML 17 trials with high-risk APL, defined by white blood cell counts over 10,000, and also the recent Apollo trial, which has been presented at the last EHA meeting, showed that also in high-risk APL, the chemo-free combination combined with 2 doses idarubicin has high efficacy also in high-risk APL. So also high-risk APL should be treated with the chemo-free combination. And as I mentioned before, the number of relapses following this treatment is very low. And in those cases, if the relapses occur after 6 months following diagnosis and atra-ato treatment, the patient could be re-challenged using the same treatment, and if they are MRD negative, they could be consolidated using autologous stem cell transplant. If they are still MRD positive, then allogenic stem cell transplant comes into question, and a combination also with Mylotarg can be used to add to the regimen and to improve the rate of MRD negativity. But as I mentioned before, the number of relapses is very low, and it's very difficult to say what to do in patients relapsing after atra-ato. Patients who relapsed after the AIDA regimen, and we've known this for many years, should be treated with the chemo-free combination. And we can also achieve cure in these patients relapsed after AIDA in about 80% of cases.